Okay, and welcome everyone to today's webinar. Thank you for joining us. This is Transform Healthcare Engagement, Unlock the Power of Multi-Channel Communications. And I want to say first, hello and welcome to everyone. My name is Melissa Maravitz. I'm with Engageus. Engageus is a healthcare consulting firm. We're located up in Boston, and we really specialize in healthcare consumer engagement. So I've been in healthcare now for over 25 years myself, working both in consulting and in health tech. And I'm fortunate that I get to work with our clients here at Engageus that are both health plan payers and health tech clients. So I get a nice sort of purview from both sides. And I'm here with one of those clients today, Clarity, and Drew Corbett is joining me. He is our co-host today. Drew is the Vice President of Engagement and Design at Clarity. He has 18 years of member engagement and healthcare strategy experience. And Drew really helps to bridge the opportunity between health plans' engagement goals and how Clarity's platform can help achieve those goals. Drew joined Clarity from HealthBox, where he advised innovation departments within traditional healthcare organizations on things like strategy and product development and go-to-market planning. So, Drew, thank you very much for joining me here today.
Thank you. Look forward to it.
Okay, so with that, let's jump right in. We have a lot to cover. First, I just want to start with some level setting around healthcare consumer engagement and what it's meaning today as of this date in 2025, because everything is a moving target right now. Engagement matters, maybe more than ever before in healthcare, and there are so many distractions right now. In the healthcare landscape, the federal government changes, such as those related to the ACA and Medicare and Medicaid, they all have significant impact on things like access to care, affordability, quality of care that affects not just the healthcare consumers, but the entire healthcare system as a whole. We've seen a lot happening with price transparency, cuts to Medicaid following what was an unprecedented expansion of the Medicaid offering, a shift to focusing on more Medicare Advantage programs and really trying to curb spending, the Inflation Reduction Act. There's so much hitting the headlines today. And so, with all those moving parts and a great deal of uncertainty in the market today, engaging your membership and understanding what their needs are is really super critical. But let's think about this from the consumer's point of view first. All those headlines that I just showed and everything I just talked about are all related to healthcare, not consumer goods, not the things that we think about every day. And healthcare is different. Healthcare, from the consumer's point of view, is a universal need, but depending on the individual, not always a universal want. So when we think about the joy you might feel opening up the fun bag of potato chips or making the purchase of a new flat screen TV or something exciting, it's not releasing the same endorphins as maybe going and get your mammogram done or some other preventive screening or care gap closure. Often in healthcare, the good is something, a trade-off for something that's abstractly good in the future. And so it is a real challenge to engage because of that. And it requires a level of customization and personalization that, frankly, healthcare often is just not attuned to. Really getting down to that N of one, because the one size fits all message that we have traditionally seen in healthcare, it doesn't drive the same desired actions as a really personalized and customized outreach can do. And that's what we're going to talk about today, is not just how to do that, but what some of those actual tactics are that you can employ, and then how you can iterate on those tactics. And I'm so grateful that Drew is here, because Drew's really going to dive deep into print specifically. So just a couple of other points about what we're seeing with our clients and what we're seeing in the market today as it relates to engagement generally. Engageus runs an annual survey that we extend out to hundreds of health plan executives, and it's a real focus on healthcare consumer engagement in the United States today. So our recent results have shown that payers have really focused a bit more on engagement in the last year, specifically though looking to further building those longitudinal records for members. which really feeds some of the other priorities that they've indicated around multi-channel communications and expanding or enhancing member services, for example. You need the right data and you need to know how best to communicate with members to effectively do that. And so, for example, if you want to have a longitudinal record, you want to be able to collect preference information so you know exactly how those members would like to be communicated with. Is it print? Is it email? Is it text messaging? And then you need data and opt in information to be able to do that. So it's a big undertaking, but all of these initiatives really are tied together. We worked with a client recently who actually implemented a repository of data so that they were able to do some rapid test and learn. And we'll show some examples of how we've helped some clients do that and how Drew and his team are actually doing that with print as well. Another finding from our annual survey was that we're seeing what's interesting is a greater emphasis on using some of those more traditional consumer engagement measurement tools to measure engagement in healthcare. So how does someone respond to your outreach? That response rate has gone back up now. It dipped for a while in terms of how do I measure the effectiveness of this engagement. Response rates back up there, as is NPS and understanding consumer satisfaction. These are things that we see routinely all the time in consumer goods, but not always in healthcare. So you can see there's been a steady rise in understanding satisfaction. And we're going to show and talk a little bit about the correlation between plan satisfaction and engagement, because there certainly is one there. So first, let's talk about engagement and kind of designing communications designed truly to engage. Our approach to engagement is the funnel that you see here. And we try to apply this engagement design to create a repeatable and really broadly applicable funnel framework that will work across whatever your outreach campaign is, whatever the type of outreach is, the populations, the lines of business. So if we just walk through this quickly, you can see on the left, data is definitely feeding the top part of this. Understanding what problem or behavior am I solving for and who needs that support so I can target my population very specifically. And then within that target population, how do I segment? It's very important to not do that broad-based approach. And we'll show some examples of that in a moment. But having the unique needs and barriers understood within your population so you can segment and message appropriately is critical. From there, understanding the channel, and then understanding what behavioral science tactics should I be using here. We'll run through a couple of those that we use today, but think about what Amazon does every day when they're marketing to everyone online. They're using tactics like scarcity, for example. If you go on and you're going to purchase a water bottle and it might tell you there's only 3 left, you feel the pressure. You need to make the purchase before they run out. It works. And they do it because it works. We don't employ any behavioral science tactics for the most part in healthcare unless we're really putting the data behind it. And so that's the challenge, is how do we put the right data behind being smart and tactical about these kinds of outreaches that we really want to maximize. And then as we get lower down there, being able to test what works is really important. How do I message someone to support and overcome a barrier they might feel to going out and getting a typical screening? And how do I design my content and then test and learn to do it effectively? And so that's what we're going to show some examples of. And Drew's got some great real world examples, even in the world of print, where he's been able to measure very effectively and then test and learn there as well.
Hey, Melissa, can I ask a question on this one? So,
Yeah.
if I were to look at this just from my own seat at a health plan and say, well, I know what my strategy and goals are, I know how I would target, but maybe, the complexity can come when it's what does the clinical quality team think? And what are the STARS imperatives this year? What is the overall marketing strategy? Maybe there have been mergers, things of that nature. So I think that, like, maybe speak just to the governance of taking an idea like this, which is really salient, but knowing that kind of the lion's den that we all go into in healthcare organizations is trying to align with these things across different departments.
Yeah, it's a great point, Drew. And you're really talking to execution where the rubber meets the road. Everyone can look at this and think, oh, that's a great idea. Yeah, we should really do that. But then when it comes down to execution, especially in larger plans, there's a lot of silos, as you said, and a lot of different incentives and a lot of different goals. And so aligning your communication strategy really is one of the most important starting steps there. And we do a lot of work today with different clients. Some are large national plans, some are smaller regional plans, where we really look to orchestrate communications. We go in and we try and do an inventory first to understand what touch points do you hit consumers with today? All of your members, what are they getting from you across the enterprise? Now, you can imagine in some larger plans that can be really tricky. It requires us to go in and inventory, to tag, to read through and understand the goals, to look for areas where we might be able to rationalize some of those communications, maybe consolidate, maybe sunset. um, do that real boots on the ground work to understand how many touch points are members actually getting and from which areas of the organization. Recently we did some of this work for a client where they actually found out that their diabetes members with diabetes were getting up to 30 different communications a month across the organization. There's so much fatigue to be had there. So to your point, Drew, getting an understanding of all that and then instituting some form of communications governance is incredibly important. Governance just is really what it sounds like. It can be an individual, it can be a department, it can be an entire advisory board that is concerned with making sure that every touch point that goes to a member matters, is valuable, um, is not so repetitive, doesn't cause fatigue, that it can be designed to be measured, and that you can actually attribute some ROI to whatever the outcomes are of that outreach. So that aspect of completing an inventory and then actually instituting some governance is incredibly important and certainly tangential to what we're talking about here to make sure that everyone across the enterprise can see success.
So I would just echo it because, you know, if we have five different departments maybe complete a funnel like this, you can really easily get into, no, my strategy is the most important. No, I heard mine on the town hall. No, this one's related to stars. I think doing that audit and having that governance around, let's just truly look at where we are today. That can sort of slice through that objectivity and say the fact of the matter is the member is receiving 30 messages a year. We can all agree that that's not the right place to start. So let's look at those messages and see where we really want the nucleus of them to be and which are the other supplements. So totally agree. I mean, it's trying to take objectivity into a subjective conversation to help get that governance unstuck.
Absolutely. Yeah, it's such an important foundational step for sure. Um, and then, once you have your arms around it, there's so many other opportunities to maximize every touch point, no matter the channel, which is really what's so illuminating about that process. And I think this slide does a good job of just showing you, here's the different types of channels that we typically see in healthcare being utilized, some much more than others. And obviously, when we think about that funnel that we just talked about, a big decision point in your outreach strategy is what channel makes sense for the communication that you're sending. We know that adding an additional channel, so going beyond just a single channel of an outbound call or a letter, depending on the type of outreach, can drive another 20 to 50% additional engagement. Because again, you're really just working hard to meet people where they are and on the preferred channel and mode that they want to be communicated with. So, for example, if you're going to be delivering some sensitive information about a plan update, maybe a warming letter goes out prior to a phone call to make sure that folks really understand it and are really engaged. And of course, cost obviously plays a role here. And you can see in this table, we've summarized some of the costs as well as the coverage potential and effectiveness. But we're going to talk a little bit more about choosing the right channel and then measuring to make sure you're seeing those outcomes over time. And again, specifically, Drew's got some great insight into print and how to maximize that as well. But a multi-channel strategy should be designed to connect your outreaches across modes. So if it's an administrative and health communication across multiple communication platforms, even let those must mails, we call them. So it's a mandated letter that has to go out, for example. Let those must mails do double duty. And Drew's going to talk through some great examples. So if you're going to be sending out a must mail letter from an administrative perspective, make sure that it also is distributing a new ID card, or utilize that outreach to drive pharmacy steerage, maybe increase brand to generic conversions, have folks register on a portal. There's lots of different ways that you can maximize an outreach. You want to make sure it's very member centric and that you're measuring it. And so I'll give you another example. For another client, we were able to actually reduce the overall number of member pharmacy communications that were going out, because we made sure each touch point that did go out the door had more value. And what happened that was surprising actually was that by reducing the number of communications that went out and reducing the touch points, members saw more value in them. Probably not a surprise, but we were surprised how quickly it happened, because members quickly realized, oh, wait, this isn't a throwaway letter, or this isn't a throwaway phone call or email. This is important outreach now. And I need to be more engaged. And we saw call to action responses really grew even into year 2. So making those touch points more valuable is critical. And Drew, back to your earlier point, doing that with a lens of already understanding what's going out across the enterprise is really important.
Yeah, and I think also to your point on the last slide, which I know we're going to revisit, but these different modalities have a different cost. And I think it's a double-edged sword on the cost of digital messages becoming so low, and we've kind of become drunk on saturation of, well, we can send out an email to a member every single day. It requires internal restraint and internal governance. Again, going back to that word of saying just because we can, does that mean we should? It's sort of a false indicator of we're communicating with the member because we're blasting things out. It's a really different proxy than we're driving effective messaging. And I think that's what we're going to get into in terms of, are you measuring what happens on the tail end of those communications? Because the bounce rate matters, or the efficacy of actually taking a requested action, that matters. And so I think that's where we're also seeing a lot of organizations having to kind of revisit their methods from the last 5, 10 years, where they've become increasingly reliant on send a lot of really inexpensive communications, and recognizing that in some instances can be doing more harm than good.
Absolutely. I think, definitely speaking to the fatigue that people feel again when they're receiving just the abundance of messages coming in across channels. So ensuring that you're maximizing that touch point is so key. Uh, just a little bit more here around engagement as it predicts plan satisfaction, and a couple of quick examples here. The one on the left talks about the percent of members actually terminating from a plan and its direct correlation with those that actually engage with and authenticate on a phone call. So in this example, those that do not authenticate are over 42% more likely to terminate from the plan. So less engagement is a direct correlation with terminations. On the second example to the right, this was, in this case, an automated phone call that went out to remind folks to get a flu shot. We actually piggybacked onto that reminder call, a quick satisfaction survey. 1 to 10, how satisfied are you with your health plan? Those who said, I'm getting a shot, I'm engaged, gave the plan a 7.5 rating on a 1 to 10 scale. Those who said, I'm not getting the shot, gave a 6.5. So it's probably no surprise that better plans have more engaged members, and it may seem like a chicken or the egg sort of problem, but engagement and plan quality definitely are linked. And members not receiving relevant, meaningful communications don't engage. So every communication is an opportunity to help or hurt. And obviously, we want to make sure that every communication is helping. Here, I'm just going to walk through an example again, back to that funnel around segmentation and how do we message then effectively to ensure we're hitting the right mark with everyone when we're communicating. When we talk about segmentation, here's an example for preventive screenings. Again, we want to start with behavior and focus on the action we're trying to drive to create that actionable segmentation. This is a great way to start thinking about these kinds of communication outreaches. If I look at my far left achievers, these are folks that are always engaged. My message to them is much more like a reminder, a traditional reminder to go get a screening, because these are people who already have a primary care physician selected, they've completed their annual well visit, they're historically up to date on their screenings, versus the far right, folks who are completely disengaged. Let's not give them the same message, right? There should be 5 different segments of messaging here and 5 different tactics to engage. If they're on the far right and disengaged, they probably have no primary care physician. So let's start there. Let's make that our first step to actually select the PCP for them and then begin from that starting block. So again, the one size fits all, we want to make sure we're using data, like we saw back in the funnel, to inform these segments so we can then use that messaging opportunity really wisely. And we're going to walk through some more specific examples with Drew, but here's a very generic mailing example, if you will. So here we're seeing some opportunity areas to actually employ some of those behavioral science tactics that we see used in other industries all the time and actually capture them here in a letter. The first tactic, for example, is using authority or a very direct tone. In this case, it's the chief medical officer. And we know using signatures with some clinical designation with the right audience has provided a 10 to 15% lift. Now, I say with the right audience because you obviously need to use data to understand that population really well. For example, we have done this outreach for other populations in different geographic locations where using a celebrity actually has worked better than using the chief medical officer, but not every time. So you need to know when the right tool is in the toolbox and when to use it. And the best way to understand that is with data. So you can see some of these other behavioral science tactics along the left side here. Cognitive load reduction seems quite simple, right? You don't want to list 100 things for folks to do. We've seen letters sometimes with 15 calls to action. 3 is really what you want to aim for here. And you can see, make sure they're called out. Using the PS um, opportunity, the PS is actually one of the most widely read parts of any letter. So if you can keep it in there, if you can make it fit, we always say keep the PS. And often it has this sort of last sense of commitment from a behavioral science perspective. And we see a campaign with a PS can often have a lift of 5 to 10% in additional incremental lift. So some of these tactics, the last one I'll just cover, urgency. In this particular example, we're seeing urgency called out. It's what is that call to action? It's called out in the Johnson box on the top right. That tactic alone is an additional 5%. So each one of these tactics, when used in concert, can really drive your intended behaviors. Now I'm going to just talk a couple more slides here before I turn this over to Drew to show us some examples. Everything we've talked about now are different strategies you can employ that relate back to that engagement funnel. If I think of this in terms of a crawl, walk, run approach, this slide would really represent the run, if you will. So, we work with some clients today where they're reaching out to their members and iterating on those communications in real time. These are agile teams. Sometimes we're setting those agile teams up at our clients. Sometimes the teams exist already, and we're coming in and augmenting and really trying to supplement those teams to make them even more effective. When I say a team, these are folks coming from data and analytics, maybe communications, writing folks, graphic design. So a whole group that sit and work to ensure that every communication going out has a very clear defined mission and is constantly being measured in real time so that it can be iterated. And obviously this requires a lot of test and learn, right? So you may send a letter out and a phone call and an email. You're going to test what subjects make the most sense, which ones got the most engagement, which messaging got the most engagement, and then learn and iterate on each one of those. This obviously is a robust approach to being engaging and optimizing every touch point. It's very iterative, and it definitely requires experimentation. So, training personnel sometimes and getting those scaled teams up and running can seem like a big task. But once they are running, it's amazing the success that they will see pretty quickly. So, for example, some of the clients we've worked with who have set up these agile teams, one drove 200% activation for enrollment in the client portal by leveraging this tactic. Another saw an 80% increase in the number of consumers using the preferred pharmacy to refill, a 2x increase in branded generic. So the results are very real. It does take, again, that crawl, walk, run approach. And so this is sort of the holy grail, if you will, of the run on this slide. And just one more real world example here where this works. We looked at annual wellness visits for one of our clients where they gave us the toughest folks to reach out to, right? The ones that they really have been unable to engage up to this point. Folks who were experiencing a lot of social risk factors, barriers to care. We targeted 74,000 of these Medicare Advantage and DSNP members. And we actually used that plan's data to break them out into 5 different personas. And you can see here, folks with incomplete HCCs, exceptionally high social risks, no designated PCP. Using those 5 personas with very specific messaging where we tested and learned, they got a 2x increase in annual wellness visits over the control, which was 2.5 million in savings. So iterative test and learn approach absolutely works. And now we're going to talk a little bit, Drew, about what you're seeing within your space and more specifically with print.
Sure. Yeah, so just a couple quick housekeepings. I did see a question come through in our question window that was just with regard to, are we receiving the slides here? I believe yes, correct, Melissa? Yeah, so everyone's going to get these, but
Absolutely.
also just to note that do hit those questions. We're going to leave a little bit of time at the end, and whatever we don't get to, we can follow up with on email, but please do send them in as you've got them here. So I'm going to spend a couple minutes just, sort of a tell you where we sit before we tell you where we stand from Clarity's perspective. I know a lot of you are probably unfamiliar with Clarity software solutions, so I at least want to give you a sense of, where we sit in the industry so that you can have in the back of your mind, who's sort of our relevant vendor or partner in this space, and hopefully that can help to invite some good conversations as you're thinking about having some of this multimodal communication conversation going forward. We're also, as Melissa highlighted a couple times, we have traditionally sat predominantly in that direct mail part of the member communication supply chain. Increasingly, we also work with email and SMS. So just wanted to give that background of we kind of dabble in all of these and increasingly look at how can they sort of work in concert. So you'll see examples of all of those, but I Melissa and I have worked together quite a bit on this. I love that slide of just saying all of these are different modes of communication. And what I'd argue just right from the top, they all perform different jobs. They're like players on a field and they have different strengths, and they shouldn't be looked at as just one size fits all in terms of what we jam through those different modalities and funnels. But let's look at them with some really discerning eye of how can we be effective with each one and how can we get more proficient with each modality. So again, our hope is to just go deep on what some of the world of that primary print and supplemental SMS and email correspondence looks like. But I think what we'd really encourage overall with this presentation is to say, understand what each of those players is doing for you and how well are they working in concert. And that's where you can start to really get more and more value out of this. So Clarity Software Solutions is based in coastal Connecticut. Has been around a long time. I would imagine a lot of the organizations listening today are probably working with Clarity. We're working with about 100 healthcare organizations. Primarily, those are medical payers, some dental and TPAs, et cetera. But we're one of those kind of back end partners that has touched most of the lives in the country, albeit in a limited capacity from a brand standpoint, because we're really focused on, and if we jump to that next slide, Melissa, we're really focused on getting core communications out to members. And so when you think about what you receive in your own mailbox at home, and if it's that ID card on an annual basis, that EOB, we're getting into tax season, you're getting those 1095s. Those are things that Clarity receives from health plan partners, and then we manage the sort of the data management of that, the print and the fulfillment of that. So just again, for a sense of scale, if we go to this next exactly, then hundreds of millions of impressions. I think the idea here is to say there are vendors in all of your portfolios that are reaching at huge scale to your members. And those are great places to better understand what the footprint of those communications looks and feels like. So this is kind of a snapshot of just a year in the life, and really just an open enrollment in the life of Clarity and how much we're distributing out. So whether it's Clarity or it's another partner that your organization's working with, I think really important to have an understanding on who is distributing those primary correspondence, because boy, do they have a huge impression on brand, right? And looking at the data on this slide, one thing that's unique to the print industry and the correspondence that's in it is, think about your own relationship with seeing an email or a text message relative to seeing a trusted brand come across on an envelope in your mailbox. And I think that's where some of these data start to really feel resonant of, I know I personally am opening things with a different level of intentionality when it's coming from my plan and it's coming physically. And I think that's something that we've all been conditioned to just sort of expect, is that emails are they're very expedient, they're very inexpensive, but they can also be, relatively speaking, more like noise than signal. And so a unique opportunity with what you're doing on a print correspondence basis is recognizing that not only are you getting more open rates, you're also getting a great land rate in terms of, we don't have everybody's email, we don't have everybody's phone number, but invariably you have, if not 100%, then very near 100% of your membership that you can reach with a trusted modality. So again, it's not to say that this is all things to all people. You need to look at your portfolio of communication assets. But when we do zoom in on what is the job that some of these core communications can accomplish, we've got a great opportunity with them. And the balance of today is talking about really optimizing that opportunity, that no question, you're spending money on it every year, and members are receiving it every year. So with that said, and this goes back to some of what Melissa talked about at the top, what do healthcare consumers want? Increasingly, we have conversations with clients around, they want, no pun intended on our own name, but they want clarity. There is a very, very complex world of healthcare that as a system they're trying to understand. And from a very personal level, they're trying to work through. And so if you can meet them with the message that is convenient and that it is easy to use and not mired in complexity, or whatever some of those complexities might be, and if it's increasingly feels like you know who I am and you're providing something relevant to me. So when we kind of mix that, you've got a few minutes when you send out that ID card, that EOB, whatever that is. Are you then populating that space and that time with your member, and they're being forefront with your brand to introduce these types of content in front of them and these types of actions in front of them? That's really the difference that we've seen in terms of engagement versus crumple it up and toss it. And of course, that has kind of a lasting effect. The more trust you build, the better you're going to get that resonance there.
Yeah, and that 75% of healthcare consumers looking for personalization is spot on, right? When you go to the coffee shop today and there's, 20,000 different options for how your coffee can be prepared at Starbucks, for example. You have those options. It's super personalized to you, and then it pops back up on the app, and it's easy to go ahead and select it next time. And so consumers obviously are looking for that everywhere now, and healthcare has just been slow to catch up with that.
Absolutely. I also think, there can be kind of a tail chase around the word personalization, and it gets emphasized at such an intense degree. And I think where healthcare is starting from, and we're looking at just some generic examples that I'll say is certainly not the entirety of the industry in plans distributing correspondence out to members. But I think it's fair to say that we've generally looked at this, at least historically, as we need to get you this message. And so that sentence started with we need you. And that's a sort of a fundamental premise of if we land this in your lap, then kind of job done. And I don't think the point is to really indict that as much as it's to say the bar is really easy to start having a brand improvement experience. Because if this is sort of our starting point, some of the tactics that Melissa referred to and some of the ones we'll show examples of, they're very approachable and they don't need to involve sort of doing an administrative overhaul. They don't need to involve having, a huge all hands to say, how do we want to change this? We can make these tweaks that are really comfortable for us as a brand and as a health plan, but they have a dramatically different interpretation from the member's perspective. So if we just look at an example of that, this is kind of the exercise that we go through with clients. We'll say, show us what you're doing today. And what we want to do is then come back and say, there are tactics that are native to consumer marketing, that are native to behavioral science that we feel like we can introduce without fundamentally changing any of the messaging. So you saw something like this in a more generic form from Melissa, but we went through this process and said, let's add some of these tactics. We know that buried somewhere in this letter at the left is a call to action. And if we think about fundamentally a call to action, it's just an invitation to a member to say, we think there's something you'd really benefit from. Let's try to get you involved in it, because then you're starting to gain value from those benefits that you're paying for. So what we do is really just bolster some of those things through the use of these tactics like QR codes, through this Johnson box up at the top right in yellow, which is going to elevate an opportunity from the balance of the content. And then through tactics like highlighting things at the below of that one unchecked box that we're going to then make it really convenient for you to complete. So a lot of different elements in here. And what I love about the overlay of these comments on the right and left side of this is, to a member, it just looks like an 8.5 by 11 piece of paper. But when we're running all of these different tactics and plays, sort of the underpinnings of how we put it together, the yield is so different. And so the interesting part of this, and what I'd really challenge all of you with your partners to ask the question, is this a graphic design exercise, or is this really an ROI driving asset that we're creating here? So we encourage our plans, as we'll see on the next slide, to start making sure that you're actually measuring on this. And it's not then we believe that one letter is more engaged with than another. It's actually looking at this and starting to track things like, was this QR code clicked? By whom was this QR code clicked? More from our Medicare line of business or our commercial line of business? More from males or females, zip code differences, etc. But you really start to get a sense of, where are we valuable in our communication versus where are we sort of noisy. In this case, we sent this out just for a period of a few months to a little under 100,000 households. And we saw 7,500 members register for the portal, which was the requested action here. That health plan shared with us, look, we, from an actuarial standpoint, ascribe about $9 worth of value to anyone that we build that digital connectivity with. And so we were able to take something that used to be just a put stamps on it and send it out to members and turn that into an ROI case of, we just took a few months and a little bit of design risk, and we created $67,000 worth of value. This is a small vignette of an example, but it just shows that we really didn't have to do anything different. We didn't have to implement a new vendor. We could just set up some really basic testing, and all of a sudden we fundamentally changed the relationship with something that we know is going to be distributed out to members in high volume every year. If we go on to the next one, this is, again, just a quick case study where we were focused on mail order pharmacy with a regional health plan in this case. And we, again, introduced some tactics that were not fundamentally different in terms of changing the content that we were presenting to the member, but just changing the form factor. One additional add-on that I'll say with this is, boy, have we all been conditioned by the financial industry to respond to a sticker that comes on top of a card. And it's been a really nice opportunity, and we'll show some examples of this later, of almost the easy button for if you want to increase lift on an action you're requesting, get that sticker on there with a really clear call to action. And we have overwhelmingly seen that you get a little more bump from those people. So when we put that marketing hat on and we say, well, what's the difference if, out of hundreds of thousands of people, we get a few hundred or a couple thousand more to register for something? That becomes a really great question around deciding what your strategic calls to action are. This particular health plan had a big push towards a new mail order pharmacy program that was implemented because they were seeing increased gaps in med adherence in their star ratings. And so I think, like a lot of health plans, it was, are we being bold enough with retail options, with mail order pharmacy options, especially in a geographically dispersed membership like we have? What we saw in running this over 4 months is that within about 30 days of receiving this content, 11,000 people at that health plan took the action and signed up for that portal register, for that mail order pharmacy program. Now, in this case, the big thing you'll see different is that this is such a high value action because we know it's directly correlated with closing a care gap, that it is at a unit value. This one is much, much more appealing to that actuarial team, and saying the ROI case on a mail order pharmacy program is more like a few $100 per member that gets involved, because we know we're going to see it in the star ratings. So again, I mean, the numbers start to become really compelling to say we didn't have to buy anything new. We didn't have to implement anything differently. We just took a fundamentally different approach to our member correspondence, and we're able to create a huge amount of outsized value. And in this particular instance, they said we ascribed that up in the millions in terms of that $350 times 11,000 people. So we're all, as organizations, you're being asked to do more with less. I guarantee it. That's what I hear from every plan that we talk to. And it's a ripe opportunity to say, we've got to get more out of everything that we're putting out to a member. And this is just, again, that vignette of what you can do on that primary correspondence side.
And, I'll just add, Drew, because this is such a great example, how important it is to test things and learn and figure out what is going to work. So, the sticker is such a good example of testing, and often folks don't or are hesitant to test because it
Yeah.
means keeping a control group. And when you're keeping a control group, you may feel like, oh, but that I should be using these funds in a different way. I should be making sure that this iteration or this intervention is being deployed across the entire population. And I totally understand that perspective. But when you don't have the control to test, it makes it incredibly difficult to know what works in terms of optimization. So we always are very mindful of that. I know you all are at Clarity as well, and trying to really drive the opportunity to test and learn.
Going even a step further on that example, and we can stay here, but just to close that one up, we did a test and learn on that one. And while the visualization of the letter I was showing on that slide had an overall higher yield, what we found was within particular pockets of the Medicare population, some liked the control group. And so there was this aha moment of, not everyone wants to just see kind of the latest, flashbang kind of design and colors and Johnson box and QR code. Some populations actually value a more sort of like stoic and sober message there. So What you learn out of it is not that, look, this one's good, this one's bad. What you learn is we now have rules that we can administer in whatever our communications platform is to say this kind of group gravitated towards this kind of letter and this gravitated towards that one. Now you're starting to get into that personalization in a really practical way without having to introduce, AI bots all over the place. Um, Last one on this, I just want to touch on this because I think, Melissa, you mentioned earlier, there are certain materials that they have to go out just more from a compliance perspective. And one of the most exciting and I think creative is with the explanation of benefits documents. So, for example, your platform vendor, whomever you're working on for your print correspondence or your EOB distribution, you're sending them a lot of information. I mean, you're sending the zip code and where that person lives. I mean, all those things that are requisite to just get communication to that person. But native to the EOB document, you also have insight into what a recent care episode looked like for that member. And that is a fascinating opportunity to just scratch that surface a little bit deeper. This is looking at, just a blinded 6 month worth of volume data for a regional health plan that we support. And we said, we've just been sending these EOBs out with complete generic type of language around them. And it's basically that actuarial table, which needs to be there, no change to that, but then no other context really. Now, this recency and relevance is a huge opportunity with a member, especially if you've got something like a care gap closure or a cost improvement opportunity. With just a little bit of data analysis, we found, hey, in the last 6 months, about 45,000 people just looking at hemoglobin A1C tests, and so our diabetes or pre-diabetic population, and then about 10,000 that went to the emergency department when they really didn't have to. We had a really low medical diagnosis need, no physician required. All of that data is just sitting there. And what we started to do is say, why don't we promote the diabetes prevention or management program to these 33,000 people? And this is just on an address sheet. This doesn't change anything about the compliance of the document. And for others, maybe they're not as aware that there is an urgent care network out there that they can utilize. So, talk about your low-hanging fruit of this person with their healthcare actions just told us that this was relevant to them. And we now can do the connection between there's something in their benefits plan that they can take immediate action on. So really, really nice opportunity to look at those EOB documents that you're distributing and challenge if you're connecting those dots as effectively as you can here. One other thing that I know is on everyone's radar, just almost ingrained in our everyday lexicon since the pandemic, is the usage of QR codes. And we've seen a really kind of validating data set that says, regardless if we're talking to Medicaid, commercial Medicare, duals, et cetera, there's a huge benefit in terms of convenience to presenting things this way to members in terms of how we ask them to take that action. It's showing to just be simpler than the phone call, and it's showing to be simpler than tracking through a URL. So it can be that fast path to showing engagement. This is a vignette of another regional client that we had worked with, distributing out to Medicare and commercial households. We had, of course, this is a genericized version of it at the left, but basically a letter over the open enrollment period that was asking members to, again, get involved in a mail order pharmacy program. Now, one thing that can be really tough for all healthcare organizations is, you say in a meeting, hey, how do we get the data? It's almost like just punching the brakes in some cases of those data queues. The IT queues are so long. So what can you do? Well, if you are implementing QR codes, then a lot of your platform partners that distribute these materials should be able to say, we can also track the clicks under those QR codes. And then if you do have the data, we can close the loop and say who not only took the click, but then who actually took the action. And for those that took the click, but then they abandoned, we should analyze those people and understand who they are and what their barriers might be so that communication can be improved in the future. I like this technology because it brings the print asset right up into the exact same kind of insights and analytical world as what we do with email or what we do with SMS. I guarantee if your organizations have email marketing or email distribution platforms like a MailChimp, a Marketo, whatever that might be, there's no way that you would invest in those tools if they didn't bring you back what were our open rates on every subject line? What were the click-through rates when we included different buttons in those emails? We haven't always been able to do that with that huge footprint of print that's going out to members, but these QR codes allow us to get proxy metrics like that. So if we sort of toyed with a design or language like Melissa was talking about, where we wanted to use authority as a way to meet that member and really encourage them to take the action, we now have that sort of open rate, so to speak, on that print asset. And again, the value is we have it at huge volumes because we can send this out to everybody, not just that subset that we have an email list for. So great technology. I'm sure a lot of you are using it. I would just say press one step further to make sure that you're using it to also measure and manage, not just to make it convenient for your membership there.
That's great, Drew. It gets right back to you can't manage what you don't measure. So
Mhm.
um, it helps bring print right back up with those digital channels for sure.
I'm just looking at our clock, Melissa. Would you mind bumping ahead maybe two more slides? And you're all getting
Sure.
the slide decks on these. You can direct on just looking at what some of those A/B tests can kind of yield in terms of interesting results. But I wanted to land on one because I talked about stickers earlier. We had done an experiment with a health plan that was, in this case, obviously national, looking across a lot of different states. And we wanted to see what the difference was of using a sticker to promote a call to action in addition to the rest of that ID card letter kit versus if we didn't use that sticker. And again, like this is just one of those places where you can get blown away by doing some simple testing. If we had a response rate of, I'm just looking at that top left of Massachusetts being, call it a 5% versus maybe a 13 or 14% just by adding that sticker, that suddenly starts to be a huge lever that's really easily at our disposal in terms of driving a population towards a certain action. Now, when we apply this at scale, you start to say we might literally have tens of thousands more people complete that action just by doing something pretty fundamentally simple from an administration process. Those are the low hanging fruit opportunities, and those are the do more with less types of opportunities that we want all of our clients to realize are out there. And maybe we'll go one more past this. I did want to, we opened up talking about how that print correspondence is a really central place that Clarity is sat, and that invariably you all have partners that support that function for you. But increasingly, it's not just multimodal, like the title of this whole presentation. It's not just multimodal, each one in a vacuum. It's multimodal in context of what you've asked a member to do previously. So a savvy way that we've looked at driving SMS and email in the most effective way is to say it should be a function of or a quick drip campaign following a message that we know was very likely opened and received. So, for example, if I've got, I'm trying to get someone to do a portal registration and I promoted that on an EOB, we know that that message was probably seen. And since it was seen, those SMS and email messages can be sent out in a way that they're now soft reminders. And so you've again sort of made it the right tool for the right job. Introducing a whole call to action via text message might be pretty difficult, but as a nudge shortly thereafter, and you're really just using this as a supplemental communication, it's a really elegant way to make sure that you've got coordination across these modalities. So I think, our biggest takeaway on all of this on send things out, test and learn, and by all means, you have to measure these things we've really seen a fundamental shift in the industry of distributing paper is a cog. That's simply a cost, and that's okay. That's getting information out to members. But to transform them into strategic assets, we need to ask those distributions to bring insights and engagement back to us for our members. So our real sort of close on this is use these tactics, use what Engage is just talking about with behavioral science techniques, with test and learn, and then make sure that you're measuring and managing with every communication opportunity with your membership. So I think I left a few minutes, not as much as we wanted, Melissa, but
No, it's okay. Those were such important examples. And as you said, just to round it out, use a combination of technology and best practices. Make sure you're getting to the end of one level. Test, 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 because without testing, you can't effectively measure, which is number three here. And start now, don't wait. We talked about crawl, walk, run, but you can get moving pretty quickly, even with just a simple example, and then kind of get more complex and layered as you go. So all super important information. And we have some time now to take a couple of questions. And by all means, feel free to put your questions into the chat area, the question area here. And we'll make sure, if we don't have time to answer them today, we'll make sure that we definitely get to them, um, even in a follow-up note to all of you. Looks like from the questions we have a couple. Yes, definitely a recording of today's webinar as well as the slides will be provided, so that is no problem. We do have one question here around QR codes, Drew. And so when assessing the power of QR codes to get a completed call to action, did you see variation in the call to action? And this person is curious if the call to action level of effort was considered.
uh, no question, yes. I think what's important around one, having a good archive of what are the actions that we as an organization want members to take. And there's probably a spectrum of how complex those are. So if I use something like download our app or register for our portal, maybe a go paperless, any of those types of, they're almost more administrative actions. I think those have lower barriers. If you're asking somebody to schedule something or you're asking somebody to get involved in a new program, it does have more complexity. So I don't think the metric should be, do we always get, 20%? I think the metric should be, how effective are we in each of these different actions? And your waterline may be 12% on portal registration, and it may be 4% or 2% on a mail order pharmacy. Again, that's okay because one is one, like a bigger population you want to do that thing, and it's easier, but the others have a real potency from an ROI perspective. So what we encourage is just to say, how familiar are you with each CTA that you're pushing and how responsive your membership has been to it? That gives you a baseline to then grow from and measure your own improvement.
Great. We have another question here, and I can start it, Drew, but I'd love to hear your take on this as well. The question is, how do you think about the creepiness factor as we get more personalized in health communications? And it's a good question. It's a question that really kind of has been begged across the board, even outside of healthcare for sure, especially with increasingly broad-based use of AI and listening tools. Um, I think what you can always bank on is that thanks to PHI and HIPAA with healthcare, there are always a lot of guardrails with just how personalized you can get in healthcare communications. When you're using information about your own membership, about medications they may or may not have picked up, for example, or care gaps they may or may not have closed, there still are a lot of guardrails around how you can communicate that personal information to them and the best way to do so. Um, I don't think you're getting to a level that's entirely creepy, if you will, by mentioning just things like, I know you haven't completed your mammogram, for example, or I see you didn't pick up your statin. Um, there is, because it's healthcare, there's so many regs that you can't get to, I think, a very specific level of detail with folks. Now, of course, you could bring in other data points that you have as well from alternative, even public sources. But it's always something to be really conscious about. in most cases, people accept, appreciate, and are looking for the level of personalization. So they're not hoping that you don't even know who they are or think of them as a number, though, especially in healthcare, which is really what we've been seeing traditionally, I think. I don't know, Drew, do you have some thoughts on that?
You know, living in a world where everything is sort of manufactured into the model said do this and this is exactly what we spit out for that. I would just say this is a great place to exercise judgment, because look at it as, I mean, this is something we do with all of our clients is let's read these messages together and see how it would feel to receive it. Places that we've seen are really prudent to stay away from, I think, are um, one, just how you say things, but expectant mothers, I think that's a place to be really mindful of how tumultuous of a journey that can be and how quickly it can change. And so it might be a place to just be more mindful of that. I also think where and how you're saying something, just like in human interaction, matters. So if you're maybe elevating something in page 2 of a member guide, that is much safer than to say, I know you've got this, and so please use that. And so sometimes it's just that collision of an interaction more than a really, really direct tap on the shoulder. But again, I think it's a great place to just sort of like take the machines out of it and use your judgment in terms of how do we feel this would resonate with our membership. So kind of an art meets science there is my perspective on it.
Absolutely. Thank you, Drew. And thank you, everyone, for joining us. We've gone a little bit over time, so we're going to end here, and we're happy to address anyone's questions or comments after the session today as well. Thank you all.
Yep, thank you guys.